Hi there, it's Chris Trimble here, coming at you from Dartmouth College, where I've been studying innovation for the last 15 years. In this short video today, I'm going to introduce my 6th book on the topic. It's called How Physicians Can Fix Healthcare, One Innovation at a Time. Perhaps I could put the book in context by asking you to consider penicillin. This wonder drug of the 1940s delivered a dramatic double win. It both improved medical outcomes and slashed system cost by keeping patients healthier and out of the hospital. And that's exciting. And because of that kind of excitement, every year in this country we're pouring tens of billions of dollars into the search for the next medical breakthrough. But here's the thing. Today's cheap and curative elixirs are not going to come in the form of a new pill or a new device. Instead, they're going to come in the form of an innovation in health care delivery. And there are opportunities for dramatic double wins in every health system and every hospital across the country. Sadly, these opportunities have been overlooked quite literally for decades, thanks to the strange incentives built into fee-for-service medicine. But now, as you know, the game is changing. And thanks to the spread of value-based contracts, the doors are more widely open than ever before for innovation in healthcare delivery. Policymakers have done their part. The rest is up to innovators on the front lines. Now, if you're a senior leader in a health system or a hospital, then chances are you're not thinking about leading innovation full-time yourself. Instead, you're thinking about creating an environment that is conducive as possible to innovation. And to me, that begins with some reflection on where your innovation dollars are going today. Perhaps you could think about where you are spending on this simple spectrum, from initiatives that are relatively small and managerially uncomplicated on the left, to those that are quite large and quite complicated on the right. Now, on the left end of this spectrum, I want you to imagine anything that one person could do on their own initiative. That could be something as simple in another industry as a salesperson trying a new sales pitch, or perhaps in healthcare, an effort to hang signs around the hospital to remind clinicians to frequently wash their hands. On the far right end of the spectrum, I want you to imagine an enormous established corporation, maybe General Electric, trying to act a little bit more like Silicon Valley and to launch a high-risk, high-growth potential new venture. Or maybe in healthcare, your own health system is investing in, I don't know, a new wearable device of some kind with hopes for outsized rewards. Now, the question I have for you is, where is the gold on this spectrum? Think about that for a minute. Where is the biggest set of opportunities? I should add, while you think about that, that generally speaking, over on the left side of the spectrum, initiatives tend to be labeled improvement, while over on the right end of the spectrum, the far right, they tend to be labeled innovation. That said, it is very hard to divide the two cleanly. There's tons of overlap, and I've never really seen anything productive happen from an effort to draw a sharp line between the two. So we're not going to worry too much about labels. So have you thought about where you think the gold is on this spectrum? Well, I'd like to suggest that there is a sharp dividing line somewhere on this spectrum, and it divides two very different approaches to innovation. There's a real wall that separates these two approaches. What you do on one side of this wall looks very little like what you do on the other. You cross that wall when you make a very specific choice, and that choice is to commission a small but full-time team to execute a single innovation initiative. And I'd like to suggest that in healthcare, there's a huge untapped pot of gold just on the other side of that wall. Because there are enormous opportunities in healthcare delivery that take the form of a new full-time team that rebuilds and redesigns care from the ground up for a particular patient population. Right now, across the country, I'd say that there are hundreds of efforts like this going on, but there are opportunities for tens of thousands. we really need to invest much more on the right side of the wall. Not way over at the right end of the spectrum, but just on the other side of the wall. Now there's something very critical that I want you to understand. You may already have a full-time team dedicated to innovation, but that does not mean that you're necessarily already on the right side of this wall. Maybe you have an innovation center of some kind or an innovation lab, but very often the purpose of these full-time teams is not to innovate themselves, but to support others in their efforts to innovate. Perhaps your innovation center reviews a lot of ideas and proposals and helps select the best, or maybe it offers a lot of tools and resources and data to help innovators on the front lines. That's great, and that can be a powerful asset, but you're only on the right side of the wall when you commission a small full-time team that redesigns, rebuilds, and actually is involved in delivering care, following some new model. That's what it takes to get to the right side of the wall. Now, I want to say that in these efforts that involve full-time teams, there is one absolutely essential ingredient to success, and that is physician leadership. That is why the book is called How Physicians Can Fix Healthcare, One Innovation at a Time. I hope you'll take a look. Thank you.